Welcome, Dr Farooq. Thank you so much for joining us again. We have some
No
more
problem.
COVID-19 questions for you from our Asian Resource Centre of Croydon members and also members from our Croydon BME forum. So if you just quickly introduce yourself and then we'll get started.
Yes, hello, my name is Dr Asim Farooq. I'm a GP who works in the Croydon area, and I've been doing so for about 15, 16 years now. I have worked in quite a few surgeries, so I think I know quite a lot of the population in Croydon by now.
Thank you. So our first question, is it true that COVID-19 is no more dangerous than flu?
I think what I'd like to say at the very beginning is that when people are trying to claim this, they're really trivializing how serious this whole thing really is. Now, yes, it's true that on average about 17,000 people die in the UK every year from flu, and that can vary. So it was a high of 28,000 down in 2014 and 2015, and as low as 4,000 in 2018, 2019. But the average is about 17,000. Now, as we are aware, already we are at 100,000 deaths for COVID as it stands, and potentially, it could be more to come. So we know it's a lot more powerful. And when Johns Hopkins University looked at the numbers, they figured out that it was about 30 times more powerful than the flu as well. The other thing to realize is that it also affects people for a lot longer. On average, about 30 days, people get affected by this virus. It can also leave people with longer term medical problems. I'm sure a lot of us have heard about long COVID by now. It also spreads a lot faster and a lot easier. We know that flu does spread, but actually that's when we are all open and not using any protective equipment. Yet still, with corona, we see a lot of people getting it with even all the precautions we try to take. And I think on top of that as well, we can see how before each lockdown, when we allowed people to go about the almost normal stuff of business again, how quickly it did spread. So definitely it's very important that we realize how serious this is, and also realize, as we are seeing now in the second wave, that we're seeing even younger and younger people now ending up in ITU or ending up dying from this.
Thank you. So our next question, are COVID-19 deaths being exaggerated?
Regarding COVID-19 deaths, if anything, they're actually being underreported, not overreported. And we know even worldwide, some examples in certain countries such as India and Brazil, they definitely are underreporting as well. But I think that the first thing to say is the vast majority of people in the UK who have died from COVID have actually had positive swabs. Now, there are some cases when we might put down suspected COVID if it was not practical for us to get a COVID swab in time, or sometimes the swab may not be positive, and even though we are highly suspicious that it does look like COVID as well. And a lot of the time we go with signs and symptoms. And the thing about COVID is it often has a very distinct set of signs and symptoms, and very often you can, say that this is very likely to be a COVID death. The other thing to mention is regarding death certificates. Now, the first thing is, despite some people claiming it, doctors are not being given any incentive to write COVID on a death certificate. We don't get any payment or incentive to do that. Now, as physicians, we have to record the cause of death accurately, and we also have to record the sequence of conditions that might have led to the death, and even any other conditions that the patient may have had that could have also accelerated the death. So an example being somebody might die with multiple organ failure, and that was caused by perhaps pneumonia, and the pneumonia was in fact caused by COVID, and we'll write all those three things on the death certificate. The other thing to realize is sometimes these different conditions might take time to develop one after another, and that's why we say if it's within a month of a positive diagnosis that it will count as a COVID death. If incidentally somebody was diagnosed with COVID positive and happened to die of something completely different, let's say a road traffic accident, we would be writing the road traffic accident as the cause of death, not putting COVID as the cause of death.
Thank you, that was very clear. So are any or all of the vaccines being used to chip and track the population?
The first thing to say is that vaccines do not contain any chips or anything that can track you. The first thing to consider is actually two things. First of all, actually, are we talking about something that's going to monitor your location or something that's going to physically control you in some way? So if we talk about something that's going to monitor your location, well, we've got much easier ways that people can do that. We've got mobile phones, social media, and even bank cards have got little chips inside them. So that will be a much easier way of doing that. On top of that, there are many, many different vaccines made by different companies in different countries. So how is it possible that all these people could collude together and work together to produce this thing and put these chips inside? We know that independent bodies have approved the vaccines. They also are checking the ingredients. So again, there's not been found any evidence of any chips or anything such as that. I think the other thing to realize, if you injected something like this into your body, the body actually would attack this foreign thing straight away, because that's what the immune system does, and therefore would destroy any such chip or whatever it would be anyway. And the other thing to realize, that if it was going to control you as a person, first of all, I don't think that technology exists anyway. But on top of that, if you injected something in the blood, it would not go past what's called the blood-brain barrier. So it would not actually possibly get into the brain either. So it's not possible that injecting something in somebody would control them.
Thank you. And our final question for today is it better, or should we just wait for herd immunity?
So herd immunity is when enough people have had the virus that then they will protect the other people. But what would be fairly clear is this would then lead to a massive loss of life. As it stands today, we've got 3.5 million cases in the UK, approximately 93,000 deaths already, which is close to a 2.5% mortality rate. So what would be the death rate if half the population in the UK got it? Or if even just a third got it? You can imagine the numbers would be absolutely massive, and really, the NHS would not be able to cope either. Now, some could argue that when the UK government was acting a bit slowly in the initial stages, that probably showed us an example of, if you allow the thing to develop, what will happen to the population. And we saw it had a massive effect on the population, and we can see what the devastating impact it would have. The other thing I want to also mention, if we encourage more and more people to get this virus, then what will likely happen is that we will get mutations of the virus, and it might be more strong. And we're maybe beginning to see some of that with different Brazilian strains and other types of strains we're seeing. So it's not a good thing to actually get more and more people to get it. We'd be better off actually achieving herd immunity by vaccinating people. And in order to get that as well, you'd have to vaccinate about 60% of the population, which should be the aim.
Thank you. And do you have a sort of a statement or a message you want to leave us with today?
Sure. So I think that the 4 questions I've answered today are examples of the misinformation, and actually are resulting in people, and these are actually people who might normally get jabs. They are now becoming the vaccine hesitant group, that I would like to call them. So they are beginning to believe these things. I've had my few relatives ring me and say they really do believe that maybe there is a chip being inserted. So I think by spreading misinformation and lies, it really does not help, and is actually causing harm and death. So please try your best to spread the correct information.
Thank you. Thank you once again, and hope you have a good rest of the day.
No problem at all. Bye.